What are some of the things when you talk to your US counterparts that they can take from Canada and kind of impart and do from an innovation standpoint? Maybe looking at how they run their businesses.
I'll be honest with you, Theo. To me, so many of us have got into this profession because of one reason.
Everyone, welcome once again to Medical Success Secrets. This is your host, Theo Harvey. I'm super excited to have a great guest today, Dr. Kyeremanteng, also known as Dr. K. He's doing a lot of great things out of palliative care, especially in the Canada space, looking for understanding around how he built out his resource optimization network. He even runs a podcast, guys. And so this is a super exciting podcast for me to get to know him better, but also for you to know what he's involved in. So Dr. K, welcome to the podcast. Can you tell everyone a little bit about yourself and how you got into this space?
First of all, Theo, thanks for having me. This is really exciting. I've booked this one highlighted this one in the calendar all week. I'm really excited about what you do and your message. So number one, thanks for having me. And in terms of what got us here, it's a bit of a long story. I'm an ICU doc and palliative care doc, and I was overwhelmed by the amount of inefficiencies in our healthcare system. And a lot of that was surrounded with end-of-life care and patients receiving care that they wouldn't even have wanted for themselves. And so I was really motivated to set up a network. We called it the Resource Optimization Network, where we look at ways to make our healthcare system more efficient. So we partnered with clinicians, with pharmacists, with social workers, other palliative care physicians, health economists. We produce many papers. In fact, we're close to over 100 academic papers now. But one thing that was clear to me was that not much was changing as a result of producing this academic output. So we thought, we got to do our best to get the word out. We got to talk about these innovative ways and innovative strategies on how to make a more efficient system. And so we decided to launch a podcast called it Solving Healthcare. And Theo, my life changed with that decision. Like, it's been one of the most pivotal moments in my career in terms of that decision. And we wouldn't be talking today if it wasn't for that. We were able to get a bit of a profile in Canada. So during the pandemic, we were able to be a voice during that time and give updates during the more peaks and valleys of the pandemic. We've been able to spin off charities as a result of having more public profile and advocating for our youth. Started a Black mentorship program as a result of, once again, having a bit of more of a profile. We haven't looked back since.
That's amazing. I think a lot of folks were on the internet doing podcasts talking about healthcare, but they weren't healthcare professionals, right? And giving their expertise and their opinions. Whereas it was amazing to see doctors like yourself rising to the forefront and giving your expertise so people can understand the needs and what they need, the help they can get from true experts as opposed to opinionators. And so I was really impressed by your background and what you've been doing, for the last, 4 or 5 years now, and building out this network. Most of my audience is based out of the United States. So we have a little bit different system under value-based care, which is about helping improve outcomes. We also have this old system of fee-for-service. Patients come in, they pay for the service, and they may or may not get well, right? And so can you talk a little bit about, from my understanding, the Canadian system is a little bit kind of like British and things like that. What are some of the things when you talk to your US counterparts, right, that they can take from Canada and kind of impart and do from an innovation standpoint that you think would be helpful for the doctors can take home and utilize in the practice of care, and also maybe looking at how they run their businesses?
Very good question. I mean, I'll be honest with you, Theo. To me, so many of us have gone into this profession because of one reason. We want to improve the lives of our patients. And to me, this has to be the cornerstone of all our mission, our approaches, everything. And when you think about, as you mentioned, value-based approach to being compensated, often this is derived from looking at the best outcomes for patients. But out of the gate, I just wanted to say that needs to be the cornerstone. This needs to be the root of all of our steps in terms of what matters the most. In Canada, we do a lot of things well, but there's a lot of things that we could learn from each other. Like, we will never turn somebody away from treatment. Like, it's a universal healthcare system. So somebody walks in the door, whether it's a heart attack, whether it's a cancer treatment, despite their insurance level, they're going to get the care that they need. That being said, because of the universality, we often don't think about how we could be more resourceful, how we could be more efficient with our dollars. So we can learn a lot from our US counterparts in terms of how to stretch that dollar. How do we make sure that patients and the treatments we're giving have value to it? So I'm skirting the question a little bit, like in terms of like what exactly we could learn from the Canadian side, but I would be remiss, Theo, not to say that it really comes down to what is going to be optimal for the patient. To me, is always going to be the center of these questions.
Yeah. Here in the US, we have this triple aim mantra, right? To your point, access to cares, up there, quality care. And the third leg of that stool is cost. And so, to your point, we're trying to kind of massage things because it was one way, and we're trying to massage it more to kind of maximize all three. But as you know, in a system, when you're trying to maximize one thing, you probably decrease the outcome of the other thing. So, yeah, you may improve quality. You can give the best quality of care, but the cost, could go up, right? That's always a challenge in US based care, trying to figure that out. And that's why we've done things like telehealth options. I'm sure you guys did as well, especially during the pandemic. That exploded for us here. Obviously, this going back to static state, but I think there's still things that we do. My company, SensorMed, we do remote care as a service. So patients who don't always see their doctor, they're able to kind of reach out to them using our technology and tools to kind of get connected to their doctors still. And I think those are kind of things that can help with quality of care and cost. So when you look at your organization and how you're taking out costs out of the system, talk a little bit about when research has shown that about 20-30% of healthcare costs are wasted. So what tips are you seeing, from your 100 academic papers that you guys saw that you could, just immediately get away some of that waste and really get the cost down when it comes to delivering great healthcare?
Great question. And Theo, I think one important message is like we often think of them as mutually exclusive. Like if you optimize quality, you might have to spend more money. It depends. Like there's a lot of things that we do that can improve quality and at the same time reduce costs. I'll give you a few examples. We have a campaign here in Canada. I'm not sure if it's in the States too, but it's called Choosing Wisely. What that does is illustrate some tests or some evaluations that we do that are costly and have minimal to no value. So I'll give examples. A blood transfusion for people that have hemoglobins that don't meet a certain threshold. So some old school clinicians would get my US units mixed up. So I'm going to just talk about once you hit a threshold that's evidence-based. In Canada, it would be 70, a hemoglobin of 70. If you're not less than 70, you shouldn't get a transfusion. But some clinicians will give a blood transfusion despite that, which costs the system at least $600 a unit of blood. And so Choosing Wisely campaign says, don't transfuse unless you meet that threshold. CT scans for people that are delirious when they're not showing any signs of stroke or bleed. That's another wasteful test. Not addressing goals of care or not having an end of life discussion with families and how costly that could be. Once again, that's not costing the system anything to have those conversations, but it certainly will save significant amount of dollars, especially when you think of, as an example, an intensive care bed in the US, which would average about $3,000 a day. So really focusing on areas where, like the low-lying fruit, you could save money and improve care. Another easy one sometimes is we give IV antibiotics when an oral one would suffice, or we give an antibiotic for 14 days when 7 days would suffice. Easy low-lying fruit steps like that once again can improve quality. Like if I'm thinking about the IV or the duration of antibiotics, reducing your risk of Clostridium difficile because you're not having antibiotics for a prolonged period of time. And the cost associated with having C. diff is significant. So I think the mental shift of having folks think they're not mutually exclusive. Often you could save dollars and improve care.
Totally agree. I'd be curious, what incentives, though, are you driving that behavior to choose wisely, right? Here in the United States, they have things, incentive payments, right? If you meet certain quality metrics, there are bonuses tied to meeting those metrics. Is that something similar that's starting to be baked into the Canada system?
Not that I'm aware of anywhere in our country, actually, which is a really great point to add. Like, I think a lot of us, at least I could say the ones that are motivated that I know, they want to just do the right thing for our patient, do the right thing for our system so that they can allow themselves to, like, those resources can go to programs that need the support, that could benefit from added funds. But honestly, it's a very good point. Our system currently doesn't reward those that are providing more value-based approaches. But I think it should be explored. I forgot to mention in the beginning that I'm the department head of our ICU in Ottawa, at the Ottawa Hospital. And we obviously have to evaluate the physicians under us. And my predecessor had this idea of having just like almost like a scoring card of physician performance. And we don't have a pay per performance in Canada, as I mentioned, but everyone's a bit competitive. If you knew that you ranked low when it came to value-based care, I think this would be a good driver for maybe changing behavior. It's not always about, in my opinion, you don't always have to spend money to change behavior. Sometimes it could be just recognition. Sometimes it could just be giving some props. And so this is something that the approach we have had to use when it came to improving morale in our ICU. We've really focused on those that are boosting morale. We highlight them, we celebrate them, and it's, in my opinion, it's made a world of difference.
And I would agree. I don't think it always has to be a monetary incentive. And obviously, in the United States, there are certain status symbols and things of that nature. Like you have a star rating system right here in the United States for healthcare plans, hospitals. So you want to be a 4-star rating plan because that just helps with awareness. Patients want to choose a hospital that's 4 stars versus one that's 2 stars. And so the incentive, yes, is financial because you get more patients coming to your hospital, but also you can put that in your marketing material and you can, everyone, the morale within the organization is a lot higher because they said, hey, we're a 4-star system, which is the top that you can get in the United States. Also, to your point, the other side of incentivizing behavior with monetary ways, you have gaming the system, right? And there have been cases where the vast majority of doctors are above board and, like you said, have a heart for their patients. But the gaming of the system comes into place, right? What patients you choose. You're going to give you the best metrics and things of that nature. So I'm not saying it's the best system, but it's just a system. And so just like with anything, you have to, figure out what works best. When you kind of think about like, let's go back to just patient care, right? Having a heart for patients. When you kind of work with patients in the ICU and kind of deal with that, kind of walk through some best practices, that you're seeing just in your day-to-day clinical work. If you're talking to like a primary care physician or just, who's not a specialist, what's some things that they can kind of look for, kind of help their patients navigate some of the critical concerns as their patients, age into later stages?
Yeah, I'm going to give a non-sexy answer. I think one of the key drivers of landing in ICU is around lifestyle choices. It's around metabolic syndrome, patients that are unfortunately obese, type 2 diabetic, hypertensive, issues with their cholesterol and triglycerides. I personally would love to see a movement, more of a movement at a primary care level, those that have access to primary care, to really emphasize the prevention. I think this would be amazing. Often when the patients come to us, the care they receive beforehand is usually optimal. If they have access to primary care, the docs are doing their best to manage their blood sugar. If they have a serious problem, they're getting in to see their physician or to their patient when they can. I honestly think a lot of people are doing the right things. But by the time you land and see me in an intensive care unit with a serious ailment, with multi-organ failure, when you leave, if you leave, you're not coming out the same person. You're not as functional. You've impacted the lives of so many around you. Your loved ones have to take time off to take care of you. You can't be back on the workforce, at least for a while. So my big call to action is let's talk about and empower folks with the tools to be proactive and prevent them from landing in ICU. So for me, it's like 4 main pillars: how to eat, movement, stress reduction, and really creating a sense of community wherever they are. Because once you manage those wellness pillars, your risk of getting seriously ill is significantly diminished. And the 80-20 of that, like the most impactful thing to me would be that nutrition piece, like really thinking about the foods we eat and educating folks on ways to stay healthy.
Yeah, I think that's so key. I think a couple of things I want to highlight there. There was some studies that have shown people who live the longest have a high indicator of what they call social fitness. So basically, they do things that engage other folks. So, like whether it's dancing or they run together or bike together because you're moving, like you mentioned, but they're also it's fun activity. You're connected. You're not alone. They have programs like that in the States, like senior sneakers. My parents in their 70s, they're part of that. They get to go to the Y and hang out with my dad. He goes hang out with his buddies, works out, share war stories, when they used to be able to jump and run and all that. And so to your point, yeah, I would love to see more of those type of programs promoted around social fitness. The pandemic, right? It affected our senior community so much. They were a lot more isolated, felt like they couldn't go anywhere. My parents, my older aunts, they were really harmed by that, right? And so having you go out and being able to kind of interact with people, but doing it in a movement way, to your point, I think can really help mitigate. And here in the United States, chronic conditions are at epidemic levels, right? Uncontrollable hypertension is at like 78%. Like they said, something like 35 million Americans don't even know they have hypertension, high blood pressure. Chronic kidney disease is another one. Diabetes, pre-diabetes is on the rise here in the United States. And so to your point, fitness, movement, but then I think the other key point was nutrition. So how are you impacting that? So, you seem like a very fit guy. What are your thoughts around, like, you kind of see people on the other spectrum, but how are you impacting that at the beginning of the spectrum when you talk to other doctors or do your podcasts or awareness? What are some of your thoughts around that?
Yeah. So first, I used to never talk about this stuff until the pandemic when I saw clear driver of dying from COVID was metabolic disease. And so I was really passionate about giving people the tools to either prevent it or even reverse it. This is where I think we need to be more educated, because when I went through medical school, if someone told me they had type 2 diabetes, I learned that it was a progressive disease. They're just going to get more and more insulin. And then I had this like almost like baffled at this idea of reversing it. I couldn't believe that was an option. And I'm now seeing it not in my practice, because that's not what I do, but in my life and then through our social media channels, through our podcasts. And I'm just so motivated to give these people the tools. And so we get educated through our podcast, through our social media channels, through our newsletter, YouTube. Like, to me, this is like my true passion, is giving people the tools. And I always say, like, distill it, make it as simple as possible, personalize it, but keep it as simple as possible. And when I think of those pillars as an example, if you could choose one when it comes to nutrition: increase your protein intake, reduce your processed foods, consider fasting, consider low carb if that's for you. But like, choose a spot that could suit your life and then that could be sustainable. When it comes to movement, most of us, all of us, could almost increase our step count by 25%. I could find you ways. You park further, you got that Zoom meeting, turn off the camera and just walk instead of just standing still or sitting at your desk. Like, there's so many ways that you can increase your movement. I'm a bias towards, like, everybody should be resistance training. Everybody should be resistance training. For example, on our newsletter, we provide people with body weight exercises that they could do if they don't have that. And then when stress management, like, I think the most efficient way of reducing stress is improving your sleep. So giving people stress sleep advice on how to do that, whether it's blue blocking glasses, whether it's increasing your step count, which also will improve your sleep, getting your screens off, dark room, eye covers, like all these little hacks that we could do. And then lastly, with community, I think that's one that you could stack with exercise, or stack with most easily with exercise. That's what I do. I'm a big hockey player. I play a little bit of old man's hockey now, but yeah, I play on 2 teams, and that's like my outside of work and outside of my household. That's another family, right? So yeah, giving people the tools, mostly on social media, is the way we've kind of provided it. But and lastly, we do have a grant that we're going to be implementing soon, reversing metabolic disease in our Black communities here in Ottawa, which is something that is really exciting.
Oh man, we should talk about that because we're doing some great work. Have you heard continuous glucose monitors like the Dexcoms and the Freestyle Libres? We have some good integration with them in our technology tools, and I'm actually using one now. To be honest with you, and I've had pre-diabetes and fighting that back. It's amazing how it changes your behaviors because you want to stay inside that line. And you say, wait a minute, it's really about your your blood sugar levels, right? Your glucose levels over the next, 60, 90 days. If you keep it around that level, that A1C is, like you said, is going down. It has no choice to. And then you change your behaviors. You're like, oh, instead of eating that piece of bread, let me eat this. Instead of butter, let me get avocado. And so it's just these little choices I'm making in my life. And to your point, eating more protein, I feel fuller, and drinking more water. And so it's like little things like that, these wearable kind of technology tools can kind of really change behaviors, because you're based out of Canada. Here in the States, we keep score for a reason, because we want to know who's winning, right? So when you see that in the United States and you're seeing your score, I got to keep it in this limit, then you change your behavior over time. So we'd love
Oh
to
my
kind of
God.
talk about that offline if there's something there. But
Oh,
yeah, we see.
absolutely. I could see some future collaboration for sure, because CGM's changed the game. I wore one for 2 weeks. It was enlightening. I was
Yes.
like, sleep was probably the most influential on my blood sugar. If you did a leg day, if you work out, you do a leg day, my glucose was like steady state, son. Walking after a meal, that was another one. Even if it was a heavy carb meal, would blunt that glucose response. And it was just, I agree
Yeah.
with you. I think if more people had access to that, it would be game changing and ultimately life saving.
Absolutely. I mean, yeah, I've always loved apples, but then once I realized the fiber content was, not as high on the sugar, it helped counterbalance. I'm like an apple. I'm like, apple a day. I'm eating like 3 or 4 apples because it gives me that sweet taste, that juice, that water feel. And so it's like, hey, I don't need the other stuff. And so to your point, stuff like that can really change people's, behavior around preventative things and metabolic scenarios. And then the other thing I want to talk about, just that muscle loss over age, right? I think I just did a research real quick. Muscle mass decreases approximately 3 to 8% per decade after the age of 30. So, look how strong you are now. As you age, you're going to lose about 10% of your muscle mass. If you're lifting 250, you get down to what, 225, 210. The 60s, you barely lifting up, if you're doing bench, you barely lifting up 200. Doing things now to kind of help mitigate against that and staying strong, I think is key. I think we're simpatico when it comes to just understanding the importance of reaching out and being proactive in your care. So I love it.
Absolutely. And if I could do a quick plug for strength too, like the death in the ICU is directly related to frailty. So I've seen
Mm,
it, you know what I mean? Like this time, a quick story. I had a guy in his 70s that had a cardiac arrest, died for a couple minutes. His wife gave him CPR. This is a guy that went to the gym 5 days a week. It wasn't a tank or anything, but he was strong. And when you see guys in their 70s that land in ICU after dying for a period of time, they don't either leave a hospital or they're institutionalized.
mm,
This man is playing with his grandkids today. And it's
mm,
because of that body armor, because he was resilient from a physical perspective, resilient from a mental perspective, while being dedicated going to the gym every day or 5 days a week. But I could promise you at that level, it makes a difference.
mm. Powerful story, man. Wow. So look, this has been great. I mean, just listen to your stories, understanding the difference between, Canada market and US market, but also just practical things you can help your patients with. So what's next for you, Dr. K? What things are you working on that you want to communicate to the audience, and where they can kind of find more about you and your story?
Yeah, main thing for me, what we were working on is just continue to get that word out on the importance of staying healthy. So that's on all our channels on social media, YouTube, Instagram, at Quadcast, KWADCAST. TikTok is our largest audience, probably. Newsletter is Solvent Healthcare Media on Substack. And so, yeah, you'll go there and you'll see all the content on how to stay healthy. We have a new endeavor. We started a supplement brand, Guide and Nutrition, which has been an amazing endeavor, and it's all about evidence based stuff like protein, collagen, magnesium, fish oil, stuff that will make you thrive. And so this has been an endeavor that we just took on this year, and it's been amazing. Yeah, that's usually where you could find us, and we're going to continue to try and make a difference. Oh, lastly, we did write a book. I did write a book on leadership called Unapologetic Leadership, from our experience during the pandemic and trying to move the needle in healthcare. You might see it back there. Oh, yeah, there it is.
Awesome. Awesome. Awesome.
But yeah, all the things.
No, I love it. I love it. You know, we need more experts like you promoting yourself and putting out there. You see other folks communicating supplements and other things, but they don't have that science background. I commend you for being out there and also still a practicing physician, right? You know, seeing patients pretty consistently as well. So, well, Dr. K, this has been a wonderful conversation. Everyone, look, take what he says to heart, practically apply it to your practice today. Make sure this you can be successful because healthcare is changing in the States and you want to take advantage of it. So check us again on the next podcast. Thank you, Dr. K.
Thank you, Theo. This has been amazing.